Let's focus now on aortic regurgitation. And remember, in regurgitation, you simply have a backflow of blood. Now, in aortic regurgitation, some of the causes may be something like trauma or aortic dissection. Now, trauma or aortic dissection may lead to an acute aortic regurgitation. However, if it's chronic, it is most likely due again to something like rheumatic heart disease. So we're seeing this rheumatic heart disease over and over and over. So again, you must know that it is very, very important. So again, in aortic regurgitation, you have a retrograde or a backflow of blood. In this case, it is going to, remember that normally blood goes from the left ventricle to the aorta. It has to go through the aortic valves. In aortic regurgitation, you have blood going from the aorta back into the left ventricle. Now, as always, your left ventricle will try to again pump harder to pump that blood out into the aorta. Now, that's very, very important because we had stenosis in the previous lecture. So again, the heart is having to pump harder to maintain a normal cardiac output. In this case, it's pumping harder, but blood is coming back down. So this can really compromise the amount of cardiac output. So depending on how severe the aortic regurgitation will determine some of our clinical manifestations. Now again, the left ventricle is going to try to pump harder as a result of pumping hard for a prolonged period of time. Something known as left ventricular hypertrophy will occur. Again, you're going to have blood accumulation into the lungs, resulting in pulmonary hypertension. This will result in heart failure if it is not corrected. So let's focus on our clinical manifestations now. Number one, severe dyspnea. In stenosis, again, you have a narrowing, so you still have blood going out. In regurgitation, however, you're pushing blood out, but it is coming back. So again, the amount of blood that's leaving the heart could be severely reduced because you're pumping blood out and then it's coming back into the ventricle. So you might not have any pumping of blood out. So again, we could have the brain affected, we could have the heart affected. If those coronary arteries aren't receiving any blood supply, well then the heart then becomes compromised, resulting in chest pain. If again we can't push that blood from the lungs to the heart, we diminish our oxygen supply, leading to severe dyspnea. And again, we have fluid accumulation or blood accumulation in the lungs, so that on its own is going to decrease the amount of oxygen. Now, again, cardiac output is decreased. Therefore, patients will suffer from hypotension, low blood pressure. The heart isn't able to pump blood out like it should. So one of the things that you must watch out for is cardiogenic shock. Again, the body is not getting the blood supply that it needs. Yes, in stenosis we had this, but in stenosis, at least when you push it out, that door closes, so whatever blood is going out is going to get pumped out through the aorta. In this case, however, blood is being pushed out, but because regurgitation is letting blood back into the heart, we don't know how much blood is going out to the rest of the body. So here we do have to worry about cardiogenic shock. Now this is a medical emergency. Patients that suffer from aortic regurgitation, one thing you must know for the Nclex is this water hammer pulse. Now think about it. The heart is pumping, boom, pumps blood out. Therefore, you'll get a good, strong heartbeat. But the moment that that blood starts going back into the left ventricle, then that blood pressure will collapse. So pump hard, and then that blood will go right back into the left ventricle, and that beat will collapse immediately. So that is the water hammer pulse. That is very specific to aortic regurgitation. Make sure you know that for the Nclex exam. Also, along with this water hammer pulse, patients with aortic regurgitation will have a low-pitched diastolic murmur. Again, a low-pitched diastolic murmur. Okay. Now, the other valve diseases, disorders, problems that we talked about systolic murmurs. In this case, we're talking about a low-pitched diastolic murmur. This is something known as the Flint murmur. So if on the Nclex exam you see anywhere something like the Flint murmur, again, this is very, very specific to aortic regurgitation.